I'm Dr. Alimou, the chair of the Program Committee of International Health and Education here in North Carolina. Our main objectives are to increase access and quality of education and health in Africa, particularly in West Africa and for the time being in Guinea. I'm offering here our perspective on the fight against Ebola. To fight Ebola, we need to address two major points. Number one, we need to look into the data of the current epidemic and make them talk to us to better shape our strategies in tracing and monitoring contact and taking care of Ebola patients by making sure that the Committee of Coordination is sharing data on the number of trace contacts who have been monitored over the period of 21 days of follow-up to see how well we are performing in that regard, if not to make the correction if needed. The Committee of Coordination should also communicate data on the number of contacts who have been monitored over a period of 21 days who happen to be positive during the follow-up period. That will demonstrate that being followed will not lead to infections. The best example is the 74 close contact of the Ebola patient in Senegal who happened to be negative over the period of 21 days of follow-up. That argument needs to be used to reduce the fear of the population and increase their cooperation. And finally, with regard to the data, the Committee of Coordination needs to release the data on the final outcome on the contact who have been followed for 21 days who happen to be positive to demonstrate that an early diagnosis will lead definitely to a better outcome. As for the second point, while intensifying action in affected area, we need to expand education and sensitization in those areas who are not affected yet to make sure that the population is prepared to act appropriately in case of introduction of Ebola, and also to make sure that the health workers are equipped and trained to handle more efficiently the epidemic and protect themselves.